Hello, everyone. I will say I'm just joining. I joined just in the prior presentation because it's quite early in the morning, our time in Western the United States. I'm here with my co-author, Dr. Melissa Anderson. We work for Southern Oregon University in the US, and our university is primarily a teaching-focused institution, mostly focusing on undergraduate students. We do have some graduate students. But I was really interested in incorporating teaching about online health information literacy at the undergraduate level, specifically for a general education course, with the goal of kind of getting a lot of students to really understand how to navigate online health information and how to understand what sources are credible and not, and understand the role of social media and misinformation, a lot of the things that we have seen for many, many years, but I think are really coming to the forefront recently with coronavirus and various misinformation that has circulated around that, at least in the US. I'm assuming some of it may have reached some of your countries as well. And so this is a practical project. It's a work in progress practical project that we're very interested in revising and redoing in future years. But essentially our interest was that we really felt that undergraduates from all disciplines could benefit from learning about online health information literacy. In terms of the research here, there's not actually as much as I would have expected when it comes to teaching online health information literacy, other than usually specifically to nursing students or to other medical students. I did find a little bit that was about teaching it to older adults, but really nothing that was about teaching it at a general education level that could kind of broadly benefit undergraduate students and the population at large as they move on from college into the world. But of course, research suggests that it is very important to be teaching health literacy to the population. One particular study found that only about half of high school students in the United States had adequate health literacy. Exposing them to credible sources of online health information is one way to potentially increase such literacy. So Melissa, who is a library faculty at my institution, and I collaborated. This is also somewhat unique, and I'll let Melissa talk a little bit more about that, but often we don't necessarily collaborate between the library and other disciplines when it comes to kind of teaching innovations and projects. A lot of our library faculty really work on things like citation style and how to find scholarly sources and things like that. But this is a little bit of a different collaborative project that we enjoyed working on together. So the curriculum here that's built into this class is that students learn about eHealth broadly. That includes things like mHealth and apps and all of the different ways in which they might encounter health information that's kind of mediated through the internet. They learn about cognitive processing theories, so things like the elaboration likelihood model, a heuristic systematic processing model, kind of understanding things like heuristics and some of the cues that we might look towards when trying to judge whether or not a source is credible. Students learn about risk. I teach them how to, just the very basics of how to calculate relative risk so that they'll understand when they're looking at studies, what that really means, or when they're looking at that information online. A lot of times risk information is included with online health information, so they'll have a sense of where that comes from. And then they participate in a library-led information literacy session with Melissa, who we'll talk in just a second. And then finally, they engage in a project to actually experience the online health information search and assessment process themselves. So I'll let Melissa talk a little bit now, assuming she's here, about her part.
Yep, I'm here. I assume everybody can hear me.
Yes, so there's 1 minute left.
Oh,
okay. Yeah, no, well, I can do this very, very quickly. So basically, as Kristin said, at our institution, a lot of times the library faculty come in to help students learn how to search broadly or how to do citations and things like that. We don't focus as much usually on higher level, sort of higher conceptual information literacy. So what Kristin and I wanted to do with this project was to incorporate some of that higher level information literacy, basically some of the frames from the framework, and really put that into the health information literacy context. So I adapted some of the frames from the ACRL framework for information literacy for higher education to the health information literacy context. And we've got those learning outcomes outlined on the slide. And we put those into the context of a search for health information online, and specifically how someone would go through that process of evaluating health information when they come in contact with it online. So I think that was about a minute, so I could talk more, but I don't want to go over time.
So essentially, I think this is definitely an ongoing project. I did it once without Melissa. We did it this year, I think, very successfully together. Students, in terms of my assessment of their learning, were very successful. In fact, I was able to use a lot of the misinformation that was circulating about coronavirus to kind of test how much they had learned from going through this process after the fact. And they did just an absolutely fantastic job really identifying how you can tell some of that information is inaccurate. I was really, really impressed actually with how they did with that. But it's something that I think we're interested in continuing to do and continuing to refine. You know, I'm interested in kind of trying to figure out how to really assess what they're getting out of it, which is something that we didn't do in a particularly structured way this year. I was kind of assessing their learning, but I wasn't really assessing my teaching